Let's talk about physical development in infancy and toddlerhood, specifically the first 2 years. So we're going from newborn to about age 2 here. Now, for physical development, let's start with birth. You've got that newborn baby there. Very often, when people send out birth announcements, they will have some stats there, some stats on their baby. They will give the weight and the height typically. So the average weight of a newborn is about 7 pounds. I've seen it even more specific as 7 pounds, 11 ounces. It could be a little bit more, a little bit less. When we give these type of statistics, they are based on norms, or sometimes you will see things presented as percentiles. What we do is we took a bunch of measurements from a bunch of babies and we basically said, hey, what's average? How big is the typical baby? And then you can compute percentiles. If you are average, you're at the 50th percentile. That means you're in the middle. All right, that means that you got 49% below. And if you have a 25th percentile, that's a situation where you're smaller than average. 75th percentile would mean you're larger than average. Do we make a lot of this? Should we make a lot of this? If you've got a baby who does not seem to be average in some way, well, remember, these are just numbers. You do have individual differences. Medical professionals who are involved in the care of an infant, they would pay attention to these numbers, and if they do seem drastically different, and if they are paired with other factors, they might want to do some additional testing on an infant. Remember, these are just numbers. You could have an individual who is smaller than average at one point and then larger than average at another point. Some are remarkably consistent, others change. It's not like you're getting a grade when you get that percentile for the size of the baby. So when they're born, around 7 pounds, at 24 months, around age 2, around 28 pounds. Now, for those of you maybe trying to lose a few pounds, that might not sound like so much weight, but let's think about that. 7, 28. That is a lot when you look at those together. 7 times 4 equals 28, right? That's a lot. Imagine getting that much bigger. Imagine getting 4 times as big as you are now in only 2 years. This is one of the many reasons that so many developmental scientists are fascinated by infants and toddlers. So much growth, so much change is going on during this time. This is also a reason that I think it's ridiculous that designer baby clothes even exist. They outgrow it as soon as you put it on them. With both of my children, people would give me cutesy little baby clothes as gifts, and in some cases my children never got to wear them because they were growing so fast. It was like, well, that 3-month onesie, they never got to put them on, and now they're already too big for it. They grow tremendously. Secondhand baby clothes make a lot of sense. Now, what else do we measure other than weight? We also measure length. We don't measure height because they're not standing up yet, so we call it length at this point. Average length at birth is around 20 inches, and at 24 months, 34 inches. Oh, that's so much growth. All right, and remember, these numbers, they're just norms. They're not grades. Any child who deviates from these norms, that could just be their individual differences. Now, another thing that they measure, when the baby is born or they go in for their first well baby visit, that's when you go to the pediatrician just to check on the baby. It's generally recommended that you're going in about once a month during that first year to have well baby checks, and not everybody's going to get this for a variety of reasons, but that is generally recommended. And one of the things they're always going to do is they're going to measure the baby height, length, not height, I said height, didn't I? Weight, length, and head circumference. They want to measure that baby's head. Why do they care so much about that baby's head? The brain is in there, and we really want to pay attention to indications of how big the head is. One thing that we do pay attention to is the fact that if a baby is malnourished, if they are sick, if they are having trouble with eating, they may lose weight in their body, but usually their head is spared. In fact, we have a specific term, head sparing. Head sparing is when the head is the last part of the body to slow down growth if there is a malnutrition situation. And that's because you want to spare that brain. You want that brain to keep growing, and that brain is growing a lot. And we'll talk about that as a separate issue in a separate video. So much brain development, so much brain growth during this time. And so you want that brain growing. Other issues, the skull is actually bigger than the brain. You've actually got a space between the brain and the skull, so there is room to grow, and the skull is soft. You may know about the soft spot on the head. The skull is in plates, and they're not fused together yet. This is one of the many reasons you have to be very gentle. You do have to be very gentle with a baby's head. They can't support their neck yet. You have to support their head and be very gentle with their head in general, and that's where that brain is. That's a very, very delicate area. Head sparing. Okay, so talking about head sparing. Okay, so just the last thing I want to say is where would malnutrition come from? We live, and at least I'm teaching, in a developed nation where you're probably thinking, hey, we don't have famine right now. Why would an infant experience malnutrition? Well, in addition to things like poverty, which does happen even in developed nations, you could have situations where an infant has trouble with feeding. They might have undetected allergies. They might have problems with the mouth with latching for breastfeeding or bottle feeding. They could have other health problems. They could have severe swallowing problems, things that a medical professional would get involved with. They could be teething. Once they start to teeth, sometimes they will not want to nurse or feed because of pain, and so they might start eating less. They can also have ear infections. Ear infections make it very uncomfortable to nurse, to drink from a bottle, and so sometimes that can interfere. Lots of things can interfere with feeding, but when that does happen, one thing that happens is that head is spared. It is the last area that's going to slow down or stop growth. Right. More to come in the future about physical development in infancy and toddlerhood.